medicine-related problems in diabetes.
Good morning, good afternoon, good evening. I welcome you once again to my YouTube channel. My name is Ngozi Ebu. I'm a pharmacist by profession. This morning we're going to talk about the drugs you take being a diabetic client. This morning I just want to talk about the feelings you get when taking some diabetic drugs. Especially today we're going to talk about metformin, we'll talk about glibenclamide, which are usually prescribed together for those who have high blood sugar. So this morning I want to talk about what the challenges or how you feel when you take some of these drugs, the problems you feel, especially when taking these drugs. So this morning we're going to talk about metformin. How do you feel when you take the metformin? Most times, some people have stomach discomfort. Sometimes you have diarrhea. Sometimes you feel like nauseated. You feel loss of appetite. And then you just generally don't feel good. So what do we advise? What do I advise at that time? I ask, this kind of effect usually resolves within a week or more. But then if it persists, I advise, please meet your healthcare professional, report it, and then it will definitely go away. But most of these problems you face is when you don't take your medication, like metformin, you must eat. Immediately after your food, you now take it. This is when it works. As I said, metformin helps you to reduce your blood sugar, as well as sometimes it makes you lose weight or maintains your weight. But then, as much as possible, when you begin to feel this kind of discomfort, it's probably because you didn't eat well or you didn't eat before taking your medication. So advice, always eat before you take your medication. Then the next one is glibenclamide. That one is what it does, it helps your body to produce more insulin so that your blood sugar can be regulated. So now, when you take glibenclamide, sometimes it lowers your blood sugar so much that you begin to feel hungry, you shake, you visit your convenience more often, you have blood vision, your heart begins to shake more or pound more, beat higher than what it should. Is because most cases you didn't eat at the right time, you drank alcohol, or you exercise too much. So I advise, please take your medications at the right time and make sure you eat at the time you are supposed to eat before you take your medication. This will help reduce the sugar level in the blood, and it make you feel better. The same thing with metformin. Metformin is very good for your body, but at the same time, these are the challenges you may feel when you take them. But if you begin to feel the way like you didn't take your medicine before taking the medication, you didn't take your food before taking the medicine, we advise, please, at the same time, immediately after, take a snack. If you now take a snack, if not, if you have a sweet drink, please drink. But if it persists, please report to your healthcare professional. And then again, I always advise, please take your medication regularly. Please uh, check your blood sugar regularly, and please stay on your diet. Please do your exercise. Sometimes when you take these drugs, still your sugar level is high. Maybe you are not on the right diet. You're not keeping to your diet. You're not exercising, and you are not doing the things you are advised to do. Please do all that we're asking you to do now, and you see that your blood sugar will get better. Thank you for listening. And please share this video. Let people be aware that even if they have a little problem because they are taking their drugs, it's not a time for them to stop. Let them continue to take their medication, and with time, their blood sugar will be regulated. Thank you for listening. And please subscribe to this channel, share, and remember, your phone is just a click away. Please, thank you for listening, and have a nice day ahead. Bye.